finish the last eval. Okay.
Okay, we'll just start over. Okay, this is the dental delivery unit, and initially you're going to have your gown, gloves, your mask, eyewear. The gloves would be your nitrile gloves and your heavy-duty gloves. Also, some of the supplies that you're going to need would be brushes, and they would be sterilized, and there would be various size brushes to go into your high-speed evacuator and your saliva ejector to clean the various parts there. They would be sterilized. Usually we find them wrapped looking something like this. So you have your brushes. You would also have disposable gauze. We have gauze and water, and you can mix in a little bit of soap, the Dawn soap in there. And here's your 3x3 gauze. Also, you have a 2x2 gauze. You could also use some Q-tips to clean with. You would also make sure you have your heavy-duty gloves again. That's important. Also, you could use some bleach, and then your evacuation system cleaner. And ours is Slug Buster. This is what one packet of Slug Buster looks like. You would mix it in the Slug Buster jug. So you would use your mild detergent, bleach, your evacuation system cleaner, which is Slug Buster, and then the water treatment tablet, which is your Citrasil. We have Citrasil boxes there. These right now contain the orange shock tablet, 10 maintenance tablets that are clear, and 10 maintenance tablets that are blue. We're trying to use blue in this clinic, and they actually come in a little wrapper which has blue writing on it. This is what they look like. They're just a little blue tablet. Okay, so once we have our armamentarium, now regarding the Clinic 1 uses the ICX tablets, and they use what we call ProEvac for our evacuation system. We use a Citrasil in here and the Slug Buster. So what you need to do is in your clinic manual, page 34 to 73, you need to read that in your manual for both Clinic 1 and Clinic 2. Right now we're focusing on Clinic 2 because that's where you are, but in the summer then we'll transfer over to Clinic 1, and you'll have to be familiar with that system. Basically it's very similar, just a couple things are different. Okay, after you've done all your work on the dental delivery unit, you need to document that you've cleaned the dental unit. So we clean that. After we clean it, then we document it in the cart maintenance book. And usually you can find that book at the instructor desk on top of the counter. So it's usually labeled cart maintenance, and this is what it looks like inside. And you're going to put the date, your cuticle number, your name, and then you're going to put for AM and PM that you did the cart, the trap, and that anything was lubricated that needed to be lubricated, especially in the ADEC carts and everything. The chair, the sink, and the wastebasket, that you've cleaned those areas. Any repairs should be logged on the clinic repair list to be taken care of. And then once those are logged and completed, then it goes into the repair log book, which will give us a history on the repairs that were made in that particular unit. Okay, now we're going to talk about just filling the water bottles. Okay. Okay, so we're going to demonstrate removing the bottle, depositing the tablet without touching the tablet, filling the bottle with water, screwing the bottle back on, and then documenting that you've changed the water. So we have two different size bottles. We have a smaller bottle, which is more on the assistance, and then we have a larger bottle, which is attached to the demo delivery unit. In the small bottle, you put one tablet, and in the large bottle, we put 2 tablets. So you want to make sure you wash your hands and really have clean gloves. And then what we would do is make sure the water is off to decrease the pressure, because if the pressure is on, you can't take it off. Then you have to unscrew the bottle, which is pretty simple. You just follow the little groove. There's a slot where the pin goes through. Try not to touch the tubing that hangs down. You're going to have to take the bottle back to the sink. And what you can do is you can take one of these tablets and try to poke it through and drop it in there. Or, you know, you can have your gloves. You can poke it through on like maybe a clean piece of gauze, and then drop it in with gloves. If you touch it with your hands, we don't want you really touching it with your hands, but if you do, then you have to wash them immediately. So 2 go into here. Then you fill it with tap water or potable water. And when you fill it, we don't want you to fill it up to the tippy top, and you're going to let it dissolve. Just fill it about up to the neck or a little less than the neck. And what happens there is once you put it back on, then the water, you need a little room for the pressure to build up. So we don't want water displacing the pressure. So then you try and slide it back on. If you have to touch this with clean gloves, you can just touch a little area. And then twist it. Okay, and then you're going to turn the water on, and all you do is follow the off on. It builds pressure, and then you can have water throughout your unit. This is a pressure gauge. It should go up to 40. Underneath here is a set screw, which you use an Allen wrench to adjust the pressure in that unit. Over here on the assistance side, we have a small water bottle, and you can do the same thing. There's a gauge there. You turn the water on and the master on, okay, for that. At the end of the day, we're going to shut the water off, shut the master off, and shut this master off that's on your delivery cart. Okay, so then after you've done that, on each door, in this clinic and that clinic, usually it's the door on the right as you face your countertop. Underneath there's a little erasable piece of paper where you can use a dry eraser. You're going to place your initial, and we're just going to have you put like changed. You're not going to like just put C and then the date you changed it, and then EXP expires 2 weeks from then. Usually the water is always used up and changed, you know, more frequently than 2 weeks, but at least you know that that's when it is. So then the next time you fill your water bottle, you're going to have to change that date and then go 2 weeks out, and that's when that expires. So that's in both clinics. So you want to document a new expiration date, and the water in there is good for 2 weeks. And then the pressure should go up to 40 psi, pounds per square inch. Okay, the next part of your eval states what day and how often the cart should be cleaned. You clean the cart once a week, and The senior class does it on Wednesday, and the junior class does it on Thursday. So both classes will be doing it because some people are in different cubicles, so you need to clean it once a week if you're the juniors on Thursday and seniors on Wednesday. And you can read that in section 2, page 6 of your policy and procedures manual that's on Blackboard. So when we're cleaning, we're once again doing the cart, the trap, lubricating, chair, sink, wastebasket. When you do the wastebasket, there's a rim around there. Make sure you get the rim too. Wastebasket, usually you have to open the cupboard, wipe the cupboard out, wipe the wastebasket down, and pick up any loose trash that has fallen out of the wastebasket. Okay, let's talk about the delivery unit, the different controls here. Number 1 is your master switch, which is right here as you face the unit on the left-hand side. When it's turned towards you, brought forward, that's the on position. This will be turned off at the end of the day. But right now, towards you is on. That's your master off-on toggle. Left side off at the end of the day. Right here is your brake release toggle. It's the little black button that's on top. You have to push the button in, and you have to lift up, and then you can move this up and down. Basically, you can move it side to side without pushing that button, but to move it up and down, you have to push the button in, up a minute, and then down. You can bring it down. So this card, this delivery card is over-the-chair delivery. Some offices you'll have side delivery, rear delivery. In the other clinic, we have a cart that is a mobile cart that basically is from the side delivery, but this is right over the chair. Air filter regulator, air water filter regulator is preset at the factory, and you have to know it should be 80 psi for the air and 40 psi for the water. In your manual, or in your installation, operation, and care manual on page 21, you can find that for the demo chair and the cart. There's just a little part there. Okay, this is your air water syringe. You have to make sure you use this properly. With the air water syringe, there's the air button, the water button. You can push each one. One you're going to get air, one you're going to get water, and then together you're going to get a water spray. When you use this, they tend to unscrew. Have to make sure you screw them on. Otherwise, this top will drip off. You don't want that happening. With this unit, the air water syringe has 2 grooves. This is Clinic 2. It has 2 grooves. The other one in Clinic 1 has 3. You have to use the proper air water syringe in each clinic. So with this one, this little ring is depressed. Then you can insert your syringe, and you always pull on it to make sure it's secure. I always test it with a little bit of air before I do anything, and I always keep retesting it. We do not want the air water syringe to be shot down somebody's throat or fall out in their mouth. So you test it, the air comes out with some pressure. This can eject and go into somebody's mouth and they can swallow it. So we don't want that. And then you have to make a trip to the emergency room. So always push in, pull, make sure it's secure, and test. Okay? Okay, the next is our rheostat. Where's the next little item? is our rheostat. This is our on-off toggle, and this is our air chip button there. So they call it the air chip valve. So when you press on the rheostat, if you press halfway down on the rheostat, you're going to get a slower speed. If you press all the way, you're going to get full speed. So when you're using like your Profiango, you press halfway, you're going to get some. All the way, you're going to get a faster speed. So that's your rheostat. This one here needs to be wiped down. A paper towel needs to go on the box, and then this sets on top of that. In the other clinic, it sets in a cradle that is attached to the cart. Your wet-dry toggle is right here and what this does is when you're using like your hand pieces, it will supply water to it. So if you push this towards the middle, you get water. To the outside, the water's shut off. You want this shut off at the end of the day. So usually we're only going to push it towards the middle when we want water, and that's when we're using a high-speed hand piece and we'll be prepping teeth. So basically it's always to the outside, and that should be shut off at the end of the day. Otherwise, if you have water coming through, it's going to come into your Profiango, and you don't want water in there. You want to make sure you just get dry air, the air going through. Okay, this is your chip air valve. You press on this, and basically what it does is it will blow air through the handpiece, and you can blow any tooth debris off the tooth. We're really not going to use it, but this is your chip air valve. Okay, underneath the cart, we have a lot of buttons. And the first set are the water coolant valves. They adjust the water flow to the handpiece. So those are the gray buttons. And there's 3 of them. You have 3 slots here for handpieces. There's 3 buttons, righty, tighty, lefty, loosey. So if we don't want any water going, we're going to make sure they're righty, tighty. We have air pressure adjustment screws. Those are the white screws, and those are for the air pressure that goes through the hand pieces. Those are white. There's 3 of them. They're white plastic on the other side. Right here on the right side is your flush toggle. And it looks just like the master off on, but it's on the right side. And to turn that on, you push that away from you. And what that does is it allows water to come through your unit lines when you have to flush these at the beginning of the day and before and after each patient. So when you turn those on, you better make sure, when you turn the flush on, you better make sure these are going into the cuspidor. That's probably going to be the easiest way, holding them and flushing into the cuspidor, which would be in the high volume vacuum, and you have that turned on. Now these are they're called instrument hangers with automatic shut-off. So if you really look here, there's a little tab, which when you put your hose and your attachment for your instrument, it shuts it off. But you have to make sure it's seated in there. If it's not seated, then it'll continue to run. But that's how they work there. So it's automatic shut off when you put it in. You can hear the air coming in and out. Now when you do attach your Profiango, you can let this down a little bit, insert it, and then turn it up and screw it on. But you have to make sure these are seated. Okay. because if some chance you've left your flush on and the water, you'll have it squirting. So make sure your flush toggle is off. Oil collector filter is found underneath this cart. It's a little tray. There's 2 screws here. And with that, you're going to have to take it off, inspect the little sponge, see if it's full. If not, it's good. If it's full of oil after we've been using this, then you're going to have to let your instructor know, and we'll have to replace the sponge. But this is your oil collector and the sponge filter. On the other cart, if you look over there, it's a little white cup that we unscrew, and we just use a little 2x2. We fold it up and put it in there and change it each time with the cart maintenance. Let's see. Drive air pressure gauge. It's right here on the front of this delivery unit, the little circle. And so you need a handpiece on here for that to register. So whether it's your Profiangle or a handpiece, that gauge will show you. Slow speed handpiece and high speed handpiece. These plain ones are for the slow speed handpieces. This is for the slow. This is for the high. This would be for the fiber optic handpiece. Okay, so then we have a saliva ejector, which is the smaller one, which would look like this. It's smaller, saliva ejector. And this is the top. Okay, so this saliva ejector, we put the saliva ejector little tube in there and use that for our patients. Some are black, some are gray. This does not get thrown out. This is not disposable. This is part of the unit. It needs to be cleaned. So do not throw that out. And inside here is a tiny little filter. Make sure you keep that, and when you go to clean, you don't poke it out, but it inserts right in there. It's a tiny little filter. We want to keep those filters. We want to keep this part too, the top of the saliva ejector. Then we have the high-speed evacuator, high-volume evacuator. And this is what it looks like. I'll get to that in a minute. And then on this one, we also have an air-water syringe in the assistance. We have a water bottle back there. This area here is our trap. And this is our trap cover. So that's our trap or our solids collector. Now underneath here, the water outlet quick disconnect is right here. It's the middle metal, and it says water. So for when you hook up a Cavitron, we'll use that. And then the water control is just to the right, righty-tighty, lefty-loosey.